Hello, and welcome to today's Train the Trainer webinar. My name is Jennifer Cinco, and I am one of the directors of the National HPV Vaccination Roundtable. The HPV Roundtable is a coalition of over 70 organizations working at the intersection of immunization and cancer prevention. We were founded by the CDC and the American Cancer Society in 2014, and our mission is to help raise HPV vaccination rates and prevent HPV cancers in the United States. To that end, the HPV Roundtable worked with nurses and nurse practitioners to develop the HPV Prevention Nurses Get It Done Toolkit. This toolkit is intended to help nurses at every practice level initiate and complete the HPV vaccination series. While a toolkit is a robust standalone resource, our development team felt there was a unique role for nurse practitioners and other clinical leaders to use the toolkit as a part of team training. Over the next hour, you will learn how to use the toolkit to empower members of your clinical team to confidently recommend and deliver the HPV vaccine. Before we begin, I would like to go over a few housekeeping items. This webinar is being recorded, and a recording, along with the teaching slides and notes, will be emailed to all attendees. All resources will also be posted to our website, and the training will be available on YouTube for on-demand viewing. All participants have been muted. Please ask your questions in the Q&A box. You can find the Q&A box along the bottom of the screen. Time permitting, we will answer questions at the end of the training. If we don't get to all questions, we will post answers to submitted questions on our website, and you can find those on the resource page with the PowerPoint and the link to the video. Many of you have asked about continuing education credits. We are working to make these available. If you would like to be contacted with information about CEs, please fill out the exit survey. You will have the opportunity to share your contact information at the end of the short survey. With that taken care of, I would now like to introduce today's trainers. Dr. Elizabeth Costas-Polston is an Associate Professor of Nursing at Uniformed Services University of the Health Sciences. She is also a researcher, women's health nurse practitioner, Robert Wood Johnson Foundation Nurse Faculty Scholar alumna, and one of the American Association of Nurse Practitioners representatives to the National HPV Vaccination Roundtable. Over the last 34 years, Dr. Costas-Polston's clinical practice, scholarly activities, and leadership development have targeted women's health, both within and outside of the U.S. Department of Defense. In her academic role, Dr. Costas-Polston works in community with others from across the DoD and federal government while training officer nurse scientists and medical students. Lacey Eden is an associate teaching professor in the Family Nurse Practitioner program in the College of Nursing at Brigham Young University in Provo, Utah. Lacey serves as the chair of the National Association of Pediatric Nurse Practitioners, commonly referred to as NAPNAP, Immunization Special Interest Group, and is one of NAPNAP's member representatives to the National HPV Vaccination Roundtable. Lacey has authored several immunization articles for the NAPNAP Ready, Set, Go parent consumer magazine and created a mobile application called Best for Baby to inform parents about developmental milestones and immunizations for their children. Her work on state legislation has led to several invitations to present at Immunization Coalition conferences, a NAPNAP chapter conference, and several local radio and television news interviews. Improving vaccine compliance is a growing passion as she works to encourage other nurse practitioners to become leaders in vaccine education. With those introductions made, I now turn it over to Dr. Elizabeth Costas-Polston.
Thank you, Jennifer. Well, welcome everybody to our Train the Trainer webinar today. We're very excited, and we hope that you will find this toolkit that's been put together beneficial. Let's see, I'm having a little difficulty moving the slide forward. Okay, there we go. So again, welcome. So the toolkit that has been put together is designed to do a couple of different things. First of all, it's designed to arm you with the education and knowledge that you're going to need to be able to confidently recommend HPV vaccination. It also is designed to emphasize the importance of compassionately responding to questions or concerns about vaccination. And it's also designed to teach and train you how to prepare your patient to receive the vaccine. And in addition to all of this, in addition to arming you with the knowledge and the training, it also is going to arm you with the knowledge to train the trainer. In other words, train other members of the healthcare professional team to be able to educate and administer and work with families and parents with regard to HPV vaccination recommendations. So the topics that we're going to be discussing, let's see, I'm having a little issue advancing the slides. I apologize. The topics we're going to be discussing are why is HPV vaccination important, HPV 101 for immunizers, how to talk to parents about vaccination, managing shot discomfort, and being a champion, an HPV champion. So the first topic has to do with why is HPV vaccination important? And HPV vaccination is important because, first of all, it is cancer prevention. And I always ask my patients and parents, because parents are also sexually active beings, did you ever think that having sex could expose you to cancer or could lead to cancer development? Sorry, could you advance that slide, please? I'm having difficulty. There you go. So we know that the HPV vaccine provides safe, effective, and lasting protection against HPV infections. And these infections, as many of us know, are related to and cause genital warts, and they also cause HPV-associated cancers, anogenital and extragenital. The anogenital include cancer of the cervix, the vagina, the vulva, in men the penis, in women and men the anus, and in women and men the oropharynx, which is kind of the new, the last decade and a half or so we've seen a new presentation, and this is the extragenital site. The oropharynx is made up of the base of the tongue and the tonsil. And again, the message that I teach and train everybody is that HPV is cancer prevention. All right, so the HPV Vaccination Roundtable, National HPV Vaccination Roundtable recognizes that nurses are change agents. And if you think about vaccination and the history of nursing, and vaccination and community health has really come out of public health nursing. Nurses have really been the trailblazers in public health historically, and we continue to be. So we're critical members of the immunization team. In fact, we're so important that of all the healthcare providers who actually recommend and have patients uptake the vaccine, nurses are number one at educating and having vaccine uptake decisions made by patients and patients' parents and or guardians. So it is recognized, well recognized, that we share or have a powerful role in shared decision making with regard to these decisions about whether or not to be vaccinated. And so because of that, because we're powerful change agents, this toolkit was designed because we have done a lot, but there is still a lot left to do, and we'll discuss that in a little bit. So again, the toolkit will increase your knowledge about the vaccine, teach you how to make a strong recommendation for HPV vaccination, and also give you some tips on how to prepare your patients to receive the vaccine. Please know that the number one reason a patient or a parent will decide to be vaccinated is based on a strong recommendation from a healthcare professional. So your recommendation, your interactions, your discussions with patients and the parents, guardians in adolescents and younger children is very critical in the decision-making process. That moves us to the next slide, which is HPV Immunization 101 for immunizers. So in addition to providing knowledge about HPV and HPV vaccination to each of you today, we're also highlighting the toolkit. And so this is one area or resource that's available to you within the toolkit. And after the webinar, I believe you'll receive all of the links to where the resources are that you can download, not only to get further, to access the resources that are available for you for further education, but also the information that we're talking about today is available to you. And again, both in a written format and the archive video that will occur after today. I'm going to move on to the next slide. So what is HPV? Excuse me, let's go back one. What is HPV? So human papillomavirus is a virus. It's a skin virus, and it is very common. And there are anywhere from 100 to 200 different related viruses, depending on what literature you read. And there are a subset of these viruses that are related to infection, disease, and cancer. And the virus has to embed, go through a break in the skin, be it a mucosal or a cutaneous skin type, and then infect that tissue. And then as we understand the biology of the virus, for example, in the cervix, where there are micro cuts or tears, the virus then gets under into the skin, into the basal membrane of the skin, and there it stays. And the longer it stays, it creates changes in the cells that are there. We know that women and men, when they're initially exposed to an infection or the virus, or new exposures to the virus after being exposed multiple times, that within usually 18 to 24 months, the virus will clear in someone who has a healthy, intact immune system. The problem comes when a person doesn't clear the virus. And we don't quite understand why or why not the virus may or may not clear. We know that in individuals who have a compromised immune system are at greater risk for not clearing the virus, hence the virus persists. And it's only in those situations where there's viral persistence and not clearance by the immune system that then transformation and or cancer can begin to change the cells and then begin to move towards, over time, a cancer. So there are two types of skin, cutaneous and mucus. And if you think about the skin on your hand and your arms, this is a cutaneous skin. It's thick and it provides a nice barrier to the rest of our body. Mucosal skin is what's in the inside of our mouth, in the inside of our vagina. It's a more delicate skin that also is much more moist because of the environment, the mouth or the vagina or the rectum, for example. And we know that along these different strains of the virus, the 200 or more related viruses, that there are a few that actually cause the most disease burden. And that has to do with genital warts, which are type 6 and 11. Genital warts cause disfiguration, physical, they cause, they're physical, you can see them, and our younger adults especially, and adolescents really are bothered by that, more so than the fact that they might have a high risk or an oncogenic type of strain. So we know that 6 and 11s are non-cancer causing, but they cause genital warts, which require treatment, and there's a lot of burden with that, and the oncogenic, which are cancer causing. And the two that are real problematic, very problematic, are type 16 and 18. As a matter of fact, most of the cancers that we see from the squamous cell cancers that we see in the anogenital area and the oral pharynx are type 16. The adenocarcinomas tend to be genotype 18. we also know that a woman who's infected with vaginal or cervical HPV can transmit it to a fetus. And in some cases, when those women have active lesions during pregnancy, close to delivery, an infant can be born with respiratory papillomatosis, which are HPV warts in their respiratory tract. And that can be very problematic also. So what about cancer? So we know that in many cases, the infection clears. But in a small subset of cases, it persists. And when it persists, it can become, over time, it'll transform into a high-grade cancer precursor and eventually a cancer. And so we know that there are 6 different types of cancers that can be caused from these HPV high-risk strains that affect about 35,000 U.S. women and men. And we see here that most of the cancer that is caused in the cervix, 91%, is probably caused by any HPV type, and the majority being 16. The vagina also 75%, the vulva 69%, the penis 63%, the anus 91%, and the oropharynx 70%. And the furthest column in this graph, the furthest right column, is the estimated number of cases that are caused on an annual basis. I would like to call your attention to the third column. You see under cervix across the row that about 10,900 new cases of cervical cancer that's caused from HPV will be diagnosed in U.S. women this year. I would like you to go to the bottom row, the oral pharynx, which is the base of the tongue and the tonsil, and see that 13,500 cases that are HPV associated will be newly diagnosed this year. So not only is HPV a concern for women, as we know historically and traditionally through cervical cancer, and that's why we have cervical cancer screening, but we've done such a good job with our screening that we're able to catch things early and decrease the cancer and the morbidity and mortality burden. However, in the oral pharynx, or the tongue, base of the tongue and the tonsils, we are seeing that it now has exceeded, the number of new cases that are HPV caused have exceeded cervical cancer in the United States. So we need to be looking in our patients' mouths. And also, just as an aside, if you look at what the epidemiologists tell us, like what is the profile, how does this present, it's about 5 men for every 1 female that's developing oropharyngeal cancer that's HPV caused. So it is critically important that we start vaccinating and get the word out to our parents and our male patients that they need to be vaccinated. That in fact, oropharyngeal HPV caused cancer from viral types 16 and 18 has exceeded the cases of cervical cancer in the United States. So this is critically important, not only for our females, but our males also. And the males, most of them have no clue. So I hope that this is a message that you all take back to your practice sites. All right, so how does the vaccine work? The vaccine is made from virus-like particles, and they kind of look like the outside of a human papillomavirus. And what happens is when you give a person a vaccine, the HPV vaccine, when you vaccinate a person, antibodies develop in response to these virus-like particles. And these antibodies prevent the virus from entering the cells, again, which then leads to infection, which if it doesn't clear can lead to disease, and even if it does clear, eventually it can lead to disease. And then if it doesn't clear and it persists, to cancer. And so the Gardasil 9, the 9 meaning it protects against 9 of the most high-risk strains of the virus, creates antibodies. So when we administer Gardasil 9, antibodies are automatically produced in the body, and we then develop a protection if we're exposed to either the high-risk or the low-risk types that are here. It is important to note that the vaccine does not contain any live virus, killed virus, or even DNA from the virus. So it cannot cause cancer or any other HPV-related viruses. And this is, often people have misconceptions or there are myths out there. So that is very important to know. All right, so how effective is the vaccine? So the vaccine provides almost 100% protection from the targeted HPV types if all the doses are received at the correct interval and if administered prior to sexual debut and or exposure to the infection, to HPV. So we know that since 2006, HPV infections have decreased 78% in U.S. women ages 20 to 24 and 38% in U.S. women for ages 25 to 29, keeping in mind that the vaccine has only been around for less than 20 years, available here in the United States. And recent studies also demonstrate that there is protection against HPV-related precancers and cancers. So there has been a reduction in precancers, the high-grade ones, 51% in women, young women 15 to 19, and 31% reduction in women 20 to 24. And all of this, keep in mind, and we're still not at the healthy people goal of 80% vaccination rate. So although we're seeing the rates that we are seeing, and they're still well below, I think 68% of the young adults in the United States have received one of the vaccines, and a little over 50% have completed it. We're still, even though we're not at 80%, we're still appreciating and realizing a relief of the burden, a reduction in precancers, which is very, very important. All right, so the next question that often comes up is the vaccine safe? And that, in fact, it is very safe. It is as safe as all vaccines that are used in the United States. And keep in mind that any vaccine prior to it being approved through the FDA goes through extensive safety testing before licensure. And even after licensure, Merck, for example, the company that owns the vaccine, has to continually report all kinds of information to the FDA. So it's not just monitored by the FDA up through approval, but it continues. As long as it's on the market and it's being administered, distributed, administered, the FDA continues to monitor the vaccine for safety. So out of 109 studies, no studies found significant increases in adverse events. And I'd like to emphasize that. You're going to hear lots of things. And unfortunately, people go to, the internet, they go to Twitter, there are a lot of anti-vaxxers who participate, and they really, or put out messages that are myths or incorrect information, which really does a huge disservice to patients and the communities in general. About over 270 million doses of HPV vaccine have been administered worldwide. The most common side effects that have been reported are pain, redness or swelling at the site, headache, nausea, and dizziness. And there is one thing that we find reported in our young adults, and that is fainting after getting a shot. That seems to be the most common reported side effect. And we know that a lot of our young adults, when they're anxious and scared, they hold their breath. They may valsalva, and they may have a feeling of faintness and or faint also. So for that reason, a lot of times I recommend administering the vaccine when they're sitting or lying on an exam table or sitting on an exam table. And also, as we all know as nurses, whenever we vaccinate, we allow the patient to remain in the clinic with us for 15 minutes after the vaccination to monitor for any immediate adverse event or side effect. All right. So when is the right time to vaccinate? Well, the on-time vaccinating is ages 11 to 12 for adolescents, but the series can be started as early as 9 years old. The 11 to 12 vaccination recommendation is considered on-time vaccination. It's also recommended for males and females ages 13 to 26, and in this population, it's considered catch-up because on time is when we want to be giving it, 11 to 12. However, there is still benefit to giving it as a catch-up vaccination from 13 to 26 in those who have not previously been vaccinated and or who have not completed the series. And of course, it works best when given before age 13 as a cancer protection, again, mostly because the response from the immune system is much more robust, and usually by this age, children or young adults have not began having participating in sexual activity, so they haven't been exposed to any of the infections. All right. So how long will the vaccine prevent infections? Well, the studies that are published suggest that it offers long-lasting protection against both infection, also disease, and cancer. And there is continued protection against not only the diseases and cancer, but high-grade cervical, vaginal, and vulvar precancers or cancers, and they have been observed up through, at this point, 10 years following vaccination. So this is a very, very effective vaccine. And at this time, we see a long-lasting protection and no booster is recommended. All right, so what is the dosing schedule? So who gets 2 doses? Our on-time adolescents get 2 doses, ages 9 to 14. They get a 2-dose schedule recommended when they get their first dose before their 15th birthday. In a 2-dose series, the second dose is given 6 to 12 months after the initial dose. So the schedule is 0 and 6 to 12 months. So who would get 3 doses? Anyone who's in a catch-up, being catch-up vaccinated, and that's 15 to 26 years old. This is a 3-dose schedule. It's recommended for those who got their first dose after age 15 and or individuals with certain immunocompromising conditions. In the 3-dose series, it's recommended 1 to 2 months. The second dose is 1 to 2 months after the initial, and the third dose is recommended 6 months after the first dose. So 0, 1 to 2 months, and a 6-month schedule. All right, so HPV vaccines can be given safely to adolescents if they have a minor acute illness such as diarrhea or a mild upper respiratory infection with or without fever. Anyone who is with an immunocompromising condition, including certain diseases or taking certain medications. However, in those individuals, the immune response and effectiveness might be less in those people whose immune systems aren't functioning. Because remember, when we vaccinate with a healthy immune system, the immune system is going to be, there will be a robust response and antibodies produced. And in someone who has some immunocompromise, be it from a disease or an illness and or through medication, the immune response will not be as robust. And who should we not give the vaccine to? We should not give the vaccine to anyone who has an allergy to any vaccine component. It's not recommended for people with immediate hypersensitivity to yeast. So that is an absolute contraindication. And individuals with moderate to severe acute illness, you may want to wait until the illness improves before you vaccinate. Those are some things to remember. It can be given at the same visit as your routinely recommended vaccines also. Okay, so we have a few questions, and so what we've done in the presentation is not only tried to address the knowledge that you need, that you would like to take out of the webinar, but also to give you an idea of how you can work when you're training the trainers and you're out going to your communities or your healthcare nurses or your healthcare team and you're educating them on what you're learning today. This is one way that you can get a sense of if they're understanding what you're talking about and make it a little more interactive. So here's the first question. Persistent HPV infection has been linked to cancers in which anatomical sites? A, cervical, B, cervical and anal, C, cervical, anal, and oropharyngeal, D, cervical, anal, oropharyngeal, vaginal, vulvar, and penile. And the correct answer is D, cervical, anal, oropharyngeal, vaginal, vulvar, and penile. So these are all the sites where we see the cancers. All right, true or false? 270 million doses of HPV vaccine have been distributed worldwide since vaccine licensure. And the answer here is true. All right, How effective is Gardasil 9 for prevention of HPV infections, disease, and cancers caused by the targeted 9 HPV types? 0%, 20, 50, nearly 100%. And the answer here is D, nearly 100% effective. Our next question, the HPV vaccine can be safely administered to adolescents presenting with A, mild upper respiratory infection, B, mild illness with fever, C, mild illness without fever, D, immunocompromising conditions, E, all of the above. And the answer is E, all of the above. All right, in order to complete the HPV vaccination series, how many doses are needed if the HPV vaccine is administered between the ages of 9 and 14? In other words, on-time vaccination. Is it A, 1, B, 2, C, 3? And the answer is B, 2. After 13 or after 15, it's 3 vaccines. So now I'm going to turn the webinar over to Lacey, and she's going to pick up here.
Thank you, Elizabeth. I am going to be talking about how you can train your office, healthcare providers, community on how to talk to parents about the HPV vaccine. So let's first talk about making a strong presumptive recommendation. And the first step is for the healthcare professional to make a presumptive recommendation for vaccination. And this should be done at the beginning of the clinical visit. Some parents might have concerns or questions even after the healthcare professional makes a strong recommendation. So if parents ask you questions about the vaccine, it's important to remember that they're coming from a place of love and concern for their child. They're not questioning your expertise or the healthcare provider's expertise. The parents just want reassurance from you that the vaccination is the right decision for their child. If you get a difficult question, the following slides present a simple 3-step plan to help you address their concerns. So, responding to questions, if you follow these 3 steps, this can help you also be able to answer their questions from a place of love and concern. So first is to breathe. And the point of this step is to help you provide some time for you to calm down your thoughts, to actively listen, and to completely understand the parents' questions regarding the vaccine. Second is to answer the question, and your answer should sound calm and confident. You should try to respond to the question at hand. Refrain from overloading the parents with overwhelming facts or information regarding the vaccine. It's easy as healthcare providers with passion for vaccines to get ahead of themselves by dumping a bunch of information onto your patients. So just remember to try and just answer the question at hand. And then third is to close the conversation with confidence. So for example, you could say something like, the first priority in our office is your child's health. That's why we strongly recommend getting the HPV vaccine today. There are a few key messages for parents that will help guide you through answering some of their questions. And the first key message is helping parents to understand why the HPV vaccine is important. And the best way to explain this is by saying that the HPV vaccine is cancer prevention. And I think I need to go back one slide, but I don't know how to do it. HPV infection is very common, and it's helpful to help your parents and patients understand that 4 out of 5 people will be infected with some strain of HPV virus sometime in their life, and that most HPV infections will go away on their own, but some persist and can cause cancer. And there's no way to know if an HPV infection will lead to cancer or if it will go away on its own. And over 35,000 people in the United States get HPV cancer each year. And then another key message is to help the parents understand that HPV vaccine, when it is given at the recommended ages, it helps to protect against certain HPV cancers later in life. The next key message for parents is to help them understand that the vaccine, HPV vaccine, is safe. So 270 million doses have been distributed around the world, and the most common side effects are mild, including soreness or swelling where we give the injection site. And studies continue to show that the HPV vaccine is very safe. It is continually monitored in the United States and around the world for its safety. And just as medical procedures make some people feel faint, sometimes the vaccine can make you feel faint. So it's important to help parents understand that that feeling of faintness comes from the concern and the anxiety from getting a shot. So it's important to educate the parents and your patients that after they receive the vaccine, that they should stay seated for 15 minutes, and that if they feel lightheaded or dizzy, they need to let their healthcare provider know. The next key message is talking about why we vaccinate kids at this age. And the reason is prevention. So all vaccinations that we provide is to prevent future infection. We give the HPV vaccine during the preteen years to protect children before they're exposed to the virus. So HPV vaccine is routinely recommended for boys and girls ages 11 to 12, but it can be started as early as 9. And the vaccine produces such a good, robust immune response in younger adolescents that only 2 doses are needed. If you wait until kids are older to start the HPV vaccine series, it will mean an extra shot and possibly reduced cancer prevention. And finally, another key message, which tends to be a common concern among parents in the pediatric clinic, is that HPV vaccine may increase their child's desire to have sex. And the key message here is no. That studies have shown that getting the HPV vaccine does not result in kids starting to have sex earlier, and that most people will be exposed to HPV at some time in their life, and vaccinating your children now to protect them will protect them all the way into adulthood. Sometimes parents have a lot of questions, even after they have received strong recommendations from their providers. And those conversations and questions can get kind of long when you have restricted time for appointments in your clinic. So here are a few tips to help you to manage that time. It's recommended to answer up to 3 questions. So answer those questions, and then if they proceed to ask more questions, then give them more time by providing them with a handout, with more information. Give them some time to look over it, and then tell them that you'll be back in to answer some more questions once they have read through the information.
So answering up to 3 questions, make sure that your answers are short, succinct, and direct. Like we mentioned earlier, try to just answer the question that the patient or parent asked. Refrain from giving excess information or facts about the vaccine. That can get confusing and overwhelming to the parents. And then try to apply motivational interviewing to help the parents understand and help you understand the parents' underlying concerns regarding the vaccine. And then once you understand their core concerns, you can use those key messages that we talked about earlier to help you address those core concerns. And then giving them time. This is a nice way for you to move on in your clinic visits and see some other patients while you are waiting while you're giving these parents and the patients time to read up on the material about HPV. And then you can go back and follow up with them and ask them if they have any other final questions that you can address. One way to approach that is to say, sounds like you have a lot of questions about the HPV vaccine. I'm going to provide you with this material to read, and I'll be back in just a few minutes to complete the procedure. And then finally, making an appointment. So even after answering all of their questions, providing them time to read through information, some people may still decide not to get the vaccine. And that's okay. That it's not a loss. It's a great way for you to let them know that you will be, that you'll help them to expect that this conversation will happen again the next time they come into the office. And you can say, that is great. I understand you have a lot of questions. Here are some more resources for you to look over, and then the next time you return to the clinic, we will be discussing the HPV vaccine again. And I even recommend to my parents to write down any other questions that they may have as they are doing their own research, so that when they come back to the clinic, we can have those all answered for them. The nice thing is there are so many resources out there for healthcare professionals to learn from other healthcare professionals on how to answer questions from parents. The CDC has a great video series called How I Recommend. There are several different healthcare providers that are interviewed in this series, and they give their recommendations on how they talk to parents about the HPV vaccine. And there are a lot of great creative ideas that are very, very helpful. Okay, so while you are doing this Train the Trainer program, it is recommended that you have the people who are participating do a simulated experience. So give your staff an opportunity to role play by dividing them into groups. Have one person act as the parent, and then have the other person act as the healthcare provider. And have the parent ask, why is the HPV vaccine so important? And then have the healthcare provider practice answering that question. And then you can switch roles and have the person who acted as the patient now be the nurse practitioner or the healthcare provider, and have them practice answering parents' questions. And doing these role plays help to prepare you to be confident and to be able to provide a strong recommendation, because you've had that practice before you're actually having to do it. The next thing we're going to talk about is how to manage shot discomfort. And very few people enjoy getting shots, especially preteens. In my experience in my clinic, it's usually the preteens who have the hardest time getting their vaccines. So it is recommended that you try to prepare the patient to be ready for the shot so that they don't experience quite as much anxiety. Research from the National Institutes of Health shows children with high fear of needles were 2.5 times less likely to start their HPV series than those with low fear. So this is an important issue. We need to do better at decreasing shot aversion or fear of getting shots. Here are some examples or ways that you can help your patients. One is give them choices. Give them a comfort menu that they can choose from to help them take control of getting the vaccine. For example, ask them what they would like to do for distraction, like playing a game on their phone or listening to music. You can offer a topical pain reliever. These are ideas that can help, that give the adolescent the choice and helps them to feel more in control. There's also something called the applied tension technique, where you teach them to tense all of their muscles for 10 seconds and then relax. And that has been shown to help reduce the fear of the shot as well. Fear of needles and shots is a true strong barrier to health and people, as it seems that the fear of needles is worse than ever before. So there are a lot of other ways that you can also manage injection pain. The order of the vaccines are actually important. It really does matter. So there are some vaccines that are more painful to give than others. So it's recommended that you give the most painful vaccines last. Another is to suggest breathing. Have your patient breathe deep into their belly before you give them the vaccine to help them to relax. And it's not necessary to aspirate when you're doing intramuscular injections. Also, you can have your patient shake out their arm and work on relaxing their muscles before they get the injection, and then using distraction techniques like we talked about earlier. It's also nice when you can distract the patient by keeping conversation throughout the entire procedure, asking them about what they like to do, what their hobbies are. Just keeping them distracted through the entire procedure is very helpful. There's also some research that shows that coughing once before and then coughing again during the shot can help people feel less pain. And one way that you can make this part of the training more interactive is to open up a discussion, asking your the staff and the medical assistants in your office what they have seen as far as shot aversion in the office and how they have managed it before. Also, ask for ideas on how to improve pain management with vaccines and maybe some possible ways to implement better and more consistent ways for managing pain with vaccine injections. And finally, what we would love to see is that clinics across the nation create HPV vaccine champions. And I believe that as nurse practitioners, we have a huge opportunity here to help others in our clinics feel like they can be HPV champions. For example, your medical assistants, your CNAs, the nurses that you work with, all of these people have the ability to be HPV vaccine champions in your clinic. And you can find more resources on this through the HPV Vaccination Roundtable Action Guide. Because we have the power to reduce HPV cancers through this HPV vaccine. We can set goals to talk with every parent of adolescent kids about HPV vaccines. We can become the leaders in our office team as the HPV vaccine champion by creating checklists or EHR reminders to make presumptive recommendations for every patient by 13 years of age. And we can continue to practice how to answer questions regarding HPV vaccine. We can also be the leaders and the examples of the MAs and the CNAs to help them also become the HPV vaccine champions in the clinic. There's also this opportunity to present certificates to the participants of your training, and this certificate is included in the toolkit, and it is encouraged that you have these certificates posted somewhere in your office. You could have them post a certificate next to the station in their clinic where they're sitting, or you could create an HPV champion wall and post certificates of all of those who have completed the training. You could even choose a HPV champion of the month and place their photo and their certificate in the lobby of your clinic so that all of your patients and families that come into your clinic can see that you have a culture of vaccines and vaccination in your clinic. And then finally, we want to know how you are getting it done. So we would like you to post stories on social media with the hashtag HPV Prevention and hashtag 2shots to stop cancer. Also posting HPV vaccine champion messages on your own offices and clinic social media sites to help get the word out that you are supportive and are HPV vaccine champions in your community. Are there any questions or comments?
All right, thank you, Lacey. This is Jennifer again. I want to thank Lacey and Elizabeth for a great training. I'm looking at the Q&A box, and we do have a few minutes. So I will read out the questions, and Elizabeth and Lacey, if you would stay off mute, we can hopefully get through to everyone's questions. So there are two questions here that focus on the same thing, so I'll combine them, but they speak to the recent FDA approval for Gardasil 9 up to age 45 in both men and women. And yes, the question is, do you recommend it for adults who have not been previously vaccinated? And I'll give each of you an opportunity to respond to that question.
Sure. Thank you, Jennifer, and thank you all for that question. That's a great question. So last October or so, the FDA approved extended indication for ages 27 to 45. Of course, the toolkit today is targeting for all, and of course, where we see the most, where the rubber hits the road and the most impact is with on-time vaccinating. So I want to mention that. So under 15, the first vaccine before 15 is where we're going to get the most impact from vaccination. After 26, in other words, 27 to 45, in fact, the FDA did not recommend widespread vaccination. Rather, what they recommend is shared decision-making. In other words, decision-making between the patient and the healthcare provider. So we know that once a person has been exposed to the infection, and we know that 9 out of every 10 sexually active people at some time or another have been exposed to HPV. And we know that, looking at the divorce rate, looking at our younger people, that, people are having multiple partners. We also know the number of partners in oral sex is an increased risk for HPV infection. So you have to sit down, the healthcare provider needs to sit down and discuss with the patient who's over 26, 27 and over, as to what their profile is. What is their history like? You know, if you have somebody who has never been sexually active, and I would caution you all with sexually active, because sexually active does not mean the same thing to every person. You know, in my practice, I've had young women who say, I'm not sexually active, but they're participating in anal intercourse so that they don't get pregnant. So they associate sexual activity with pregnancy. So you have to be careful as to, you know, what people mean, because sometimes we're using words and you know, we're not communicating because we have different meanings or understanding of how we define words. So again, it's a shared decision-making. It is not recommended to widely vaccinate all 27 to 45-year-olds. And the reason is because the majority of them have already been exposed to HPV, and for many of them, because of other partners or multiple partners many times. So we know that the effect and the effectiveness of the vaccine will be less if someone's already been exposed, because we don't know what strains they've been exposed, we don't know how many infections they've had, et cetera. So it is a shared clinical decision-making. So the FDA recommendation is not for widespread vaccinating, in fact, of 27 to 45-year-olds. But again, clinical decision-making, case by case, discussion with the healthcare provider and the individual who's over 27 and up to 45 as to are they a good candidate for the vaccine, and what would the benefit be, or would it be minimal benefit? Another thing to keep in mind, and we're starting to begin to see in some areas, vaccine shortage. So we have to be very careful. You know, the indication came out and people thought, oh, that means just vaccinate everybody, 27 to 45. So what's happening is people are vaccinating and really the benefit does not outweigh any risk. So we have to be careful with our resources also. Lacey, do you have anything to add?
That was perfect. I don't have anything to add.
Thank you.
Great. So another question is, could you give us some sample wording that would help us, the trainers, to get staff who are participating in the training to feel comfortable with recommending the HPV vaccine at age 9 or 10 years of age? And I will say I love this question because we do hear anecdotally from providers who are the ones who are, you know, giving the injections and the vaccines, and that it is easier for them to initiate HPV vaccine at age 9. It sort of takes a lot of concerns parents might have about sexual debut off of the table. It's one shot and they have much longer, you know, they have 4 years to get the vaccine instead of 2 years to get it before they're 13. But Elizabeth, Lacey, do y'all have language that you use, or have you heard of language around starting recommending the vaccine, HPV vaccine at age 9 or 10?
Lacey?
The language is basically the same as what I would recommend at 12 or 13. Just basically saying that I strongly recommend that they get the vaccine. It's safe to give it at 9, and the earlier you give it, the more time they have to build a robust response and create that immunity. And the other thing that I see in my clinic is when I have my medical assistant or my CNA bring my patients back, oftentimes parents are asking the MAs questions and their opinions on the HPV vaccine. And so during this training, it's really important that they understand that they can answer these questions, and if they don't feel comfortable answering them, they need to practice so that they can give those strong recommendations as well, because the parents give just as much care just as much what that MA is saying as they do, or they take it, they highly value what the MA is saying as well. And so it's important that they're very well educated and willing to talk about it.
And this is Elizabeth, so I would like to add a couple things from my experience in women's health. A couple things. First of all, it is very important that you have nurses who are talking to patients who are supportive of vaccination. if you have nurses that are not supportive of vaccination, until at such point in time, or if they ever become supportive, they shouldn't be the ones that are communicating with your patients. So you need to strategically set up, you know, your encounter for success, right? So you don't want somebody who is not supportive, that's all. The second thing is, when I approach my discussions with my parents, because especially when we get to that young of an age, I talk to the parents about the fact that I'm not in a position to talk about morality or sexuality, you know, right and wrong. I'm not a moral compass. I'm there to talk and to advise them on their child's health. And this is a proven cancer prevention vaccine. I don't even talk about, that is the lens that I talk about it from. This prevents cancer. It prevents precancer. Why would you not? The hepatitis shot prevents cancer. We give the hepatitis shot. Why would we not give another infectious disease, meaning a virus, such as HPV? Why would we not administer another cancer prevention vaccine? You know, why would you put your child in a position where they potentially could contract even genital warts, which is benign, right? Which most of our young people are more concerned about than cancer risk, because we know at that age they're invincible, right? They're immortal kind of thing, right? So again, I talk to the parents. I'm not making any judgments. I'm here to talk about protecting your child's health. And my lens and focus is through cancer prevention. This is a cancer prevention vaccine, a very strong message.
Thank you, Elizabeth. And that is where we'll stop for today. I know that there are still questions in the Q&A box. We will post written responses to the questions that we did not get to today. So those will be available on our website, along with a link to this recording, a downloadable version of the teaching slides complete with notes, and also links to the certificate, the toolkit itself, and other fun graphics and social media. We've developed some social media graphics and a promotional toolkit. So all of that is available on the HPV Roundtable's website. And if you have any questions about the content or what you've heard today, please feel free to reach out to us at hpv.vaccination.roundtable@cancer.org. I want to thank everyone for attending today, and we will please fill out the exit survey, especially if you are interested in CE credits, and we will be emailing you with this information, and also any future nursing-specific HPV vaccination roundtable resources that are developed or are created to support this resource. So thank you so much again. Thank you, Lacey. Thank you, Elizabeth. And I hope you all have a wonderful rest of your day.